Welcome, everybody. Good evening to our program, Serving Communities with Metro Inclusive Health. So before, I am joined here today with Nate Taylor. How are you doing, Nate?
I'm doing well. How are you?
I'm doing great. So before I hand things over to you, I'm just going to cover a few things on the library side. So the first is that this is a program that is in collaboration with the University of South Florida. So this is a really awesome partnership that we have called Libraries Build Communities. So this is part of our partnership. So this program is part of our partnership with them. And as always, we always have a book shout out for all of our programs, a book or resource shout out. So the resource that we are shouting out today, or the book we're shouting out today, is Wintering: The Power of Rest and Retreat in Difficult Times by Katherine May. This book can be found on one of our ebook platforms, Libby by Overdrive. So that is an app that's available on all devices. Definitely recommend that you check that book out. So now I am going to hide myself and I am going to hand things over to Nate. So Nate, go ahead and take it away.
All right. Good evening, everyone, and thank you for joining us. My name is Nate Taylor. I'm actually the Division Director for Metro Inclusive Health. And what we're going to do today is talk a little bit about the programs and services that we offer. And if you have any questions, feel free to hit us in the chat box and we'll see what we can do to help you out. All right. So Metro Inclusive Health is a 501c3. It was established in 1993, but our board actually formed in 1992, really trying to figure out the needs of the community and what they can do to help. It started, so we're almost hitting that 30-year mark. So we're very excited about that, and we are committed to providing quality health and wellness services that are inclusive, relevant, and supportive, and represent the lifetime continuum of the diverse people in our community. So that is everyone from A to Z. Anyone that needs assistance, we are definitely here to help. So who we serve and where we are. So Metro started out in one place, one building at of MCC King of Peace Church in St. Petersburg, Florida. Fast forward almost 30 years, and we have 4 brick and mortar locations, including a retro and retail thrift store in St. Pete and a welcome center in St. Pete. So we have locations in the Ybor City area in Tampa. That office is actually relocating in the summer up the street on Nebraska Avenue to 30,000 square feet of space due to the fact of just the growth and the need of the community in a 33605 zip code. So we're very, very much looking forward to that. We are refitting or remodeling the historic German American Club on Nebraska Avenue and building an additional building alongside of it that's 15,000 square feet for our medical center. So we'll be a full health and medical center that services the entire community in the Tampa Bay area, in the Tampa area. There we have an office in Newport Richey and also in Clearwater. All right, so a little bit about our services. We offer over 100 programs and services. That is a lot of services. We started out with 1, and now we have over 100 in a variety of different areas. So I'm going to tell you about our major ones today. First is our primary health care, and that encompasses physical exams, consultations, pap smears, wellness checks, diabetes, anything that you would go and get a regular checkup for at the doctor, we are there for. So just any primary care need, we are there to help service you. And we also have a referral service where we can refer out to specialists that we don't handle. We also do HIV, Hep C, STI treatment and testing. We just started a new testing system where we actually do STI panels for a variety of STIs, including gonorrhea, chlamydia, in about 90 minutes. Most of those tests you have to send out to labs, and it's about a week to get them returned. We have a system now where we can actually get you those results in 90 minutes. So if you're looking for any of those types of needs, feel free to see us. We also have HIV medical care with our partners with CAN Community Health, who's based out of Sarasota, but they're actually a nationwide company. We have sexual health and prevention programming, trans health services, including counseling, psych med management, as well as counseling services. All right, so a little bit about our counseling services, our behavioral health counseling services. As we service everyone from youth to adults. That's individual, couples, family counseling. We do counseling for youth in regards to bullying, coming out, and things of that nature. There's different groups of programs we'll talk about there. We have trans support. So anybody that's considering transitioning or changing their gender, we do that support as well. And then also general counseling, day-to-day life type counseling, family counseling, or marriage counseling, all of the above. We have all different types of providers and behavioral health therapists that work with us to help provide those services. All right, another big piece of Metro, since we started out doing HIV case management for men in '92, what comes along with that is sexual health education to kind of help those in the prevention realm before they get to the step of needing someone to handle HIV care. So we have a full department of navigators and specialists in prevention sexual health. What they do is they provide support programs or peer support programs. A lot of times we find that kids or youth are having discussions with their parents or in schools about sexual health and things like that. Well, if there's a parent that feels like they're not the best, they don't feel like they would be the best to do that, or they need assistance in doing that, we will step in and we have those programs to help assist with that. So for the adults who are already practicing or thinking about practicing in the sexual area, we have groups like City Mix, which is a group where they just come together and talk about sexual habits, cleanliness, and things like that. We have a positive impact group that is for people that are HIV positive, to talk about how they kind of go through life, how do they operate, how do they navigate life as an HIV positive person. We also have Connect, and Connect is where we have a partner. We have a partner couple. One is positive and one is negative. They call that magnetic. So we call that Connect, and that's kind of like couples counseling for those that are HIV positive and HIV negative that are dating each other. Navigating success and closing the gap. Those are the programs I was talking about earlier that are for our youth 13 to 19, and then 20 to 24. So we break them up because there's different levels of experience based on age. So we found. So they offer incentives for youth that attend those groups. There are a lot of peer things that happen in there to where they're kind of trained to actually talk to their friends about best practices for sexual health and things like that, how to take care of yourself. So it's a great program to be involved in. And again, this costs them nothing. They do get incentives to actually participate in the program. And it's a state-funded grant. The TOPWA program, which we just expanded into Pinellas County, it was just in Hillsborough, but it is our program for pregnant women. It's target outreach for pregnant women, and that is for women, mostly those that are HIV positive. It's a support group. It teaches them life skills. It teaches them the best health practices. There's a lot of misconceptions when it comes to the child if a parent or if the mother is HIV positive. A quick fact here is that just because a mother presents as HIV positive, it does not mean that their child is 100% guaranteed to be born HIV positive. So those are things that those are life-saving facts, and a lot of times folks don't know that. So we're there to provide that education, but also there to provide the support of, if you don't have family or friends, we throw baby showers. We provide vouchers to the thrift store for clothing and things like that. So that's another community resource that we offer in the prevention sexual health area. And again, our treatment for people that are HIV positive is done by CAN Community Health. So medical case management, those are the folks again. That's where we were birthed out of. The folks that actually do the medical case management. That is someone that you're assigned to when you're HIV positive. That basically makes sure that you're making your medical appointments, that you have housing, that you have transportation, that you have food, insurance coverages, signing you up for programs that do medical copay to help you pay your bills. The medication can be quite expensive for HIV positive folks. So there are different programs like Ryan White that will assist in making sure that those medical bills are covered. So if you know anybody that is HIV positive, always, always, always refer them to a resource, because again, that's another stressor that we try to alleviate. All right, our LGBTQ plus programs. This is a program that's near and dear to Metro. It is really a community, all about the community when it comes to this. It's a real holistic and wellness approach to things here. We not target, but we have attendees from youth all the way to seniors. They start at 13 and go all the way up through the senior years. So we have programs that are like youth nights, to where they do, and then because of COVID, we're doing them virtually. So on Zoom, on that secure platform, everything is password protected and everything. They participate in just programming to where they can kind of talk about life, play games, watch movies, and kind of just build that kind of fellowship with folks that are just like them or different, and people who want to meet new people. Sometimes it is a lot to be in school and around people that you feel that don't understand you, or you feel like you don't fit in. This is a totally safe space for anybody that is LGBTQ plus or an ally. So again, we're inclusive. It may be LGBTQ plus programming, but we don't turn folks away just because they don't identify as LGBTQ plus. We pride ourselves on just respecting everyone and everyone's views. You come in, you have a good time, meet good friends, and just move forward from them. Try to be positive and productive. We also have like a peer support group that is kind of the more serious side. It's kind of a peer-led peer support group. So those are for the times where you're talking about, oh, I had a breakup, a high school student had a breakup, and they have nobody to talk to about it. Well, they've got this group to talk to. I'm not being accepted at home, or I'm being mispronounced. Those types of things. We have art projects that help the youth kind of express their issues or whatever they may be going through. My favorite one is there's a silhouette of a person's human head, and on the outside they draw like their happiest face, lots of teeth, smiles, and everything. But in the brain part, they draw things that are kind of sometimes morbid, but sometimes like feeling sad, feeling down. So they're putting on a front on the outside, but on the inside they're kind of really torn up. So it's a great way for us to kind of gain that kind of knowledge and then try to help and assist that youth from there. We oftentimes have behavioral health counselors come in and kind of help guide the youth to be able to, kind of make sure that they're in an okay place. As far as adults, we have kind of a young adult socials to where college kids on up can kind of meet people. If you're not into the bar scenes, if you just want to meet people and you want someone that maybe want to meet someone that's just kind of like into books or being at home or doing dinners or anything like that, this is the place for you to meet people. So if you feel like you can't meet them elsewhere, this is kind of a safe space to meet new people that want to meet people. That's the whole objective of the group. And when we were able to meet in person, we were able to have potlucks and game nights and things like that at our Welcome Center in St. Pete. But now we're doing it virtually on Zoom. And then, since we've lightened COVID restrictions a little bit, we will have small groups meet in our grand hall with no more than 10 people. So that does still happen. And then we have our senior group, our SAGE group. SAGE National is a national senior LGBT group. And with that group, it was formulated because when you are LGBTQ plus and you may not have children and your family may be passing on and you kind of feel like you're left alone, it is really built to make sure that you do not experience isolation, or we try to alleviate as much isolation as possible. And so those groups that kind of meet, they have coffee talks, they have just discussion groups where they come just talked about things that they went through in their past, things that they go through now, fun stuff, dating, life things, traveling. I mean, no topic is off the table there for them, but it's just a way for them to really be there and connect and be there one-on-one and in a group setting as well. So a lot of them just kind of make lifelong friends from this. Before we used to host quarterly dinners for them, take them on trips and things like that. Now they kind of take themselves out to dinner and go and do things in parks and stuff like that out in the open. But again, with COVID, if we didn't have programming like this, they would be stuck at home and not know anyone. So the group has really grown and thrived because they're able to meet people and still stay connected and not be isolated due to the pandemic. Another piece of our LGBTQ plus programs is our training. We have an inclusivity and awareness training that basically teaches organizations, businesses, restaurants, banks, you name it. We go out and we train folks on how to treat people, and it's LGBTQ plus focus, but it really is a training on respecting people and respecting each other. So, just going into work and not making inappropriate comments over something that you don't understand. Calling someone a she when they are they, someone that identifies non-binary, or someone that even racial competency, all of that. So we address all of those different types of things. We use examples and have conversation and Q&A and everything to go along with that. So organizations are interested, we do offer inclusivity trainings and certifications in inclusivity. So you can definitely reach out to me if you would like to set something like that up. We have trans health care. Same thing. You go into a doctor's office and their paperwork only gives the gender male, female. Well, you don't identify as that. You may be someone that is trans feminine or trans masculine. You don't know which box to check. A lot of times we'll go into those healthcare facilities and go and do an assessment of their facility and to how to make their facility more gender neutral, to make it open and accepting for everyone. And then the Sage Cares Clinic, the Sage Cares training, that is a training that basically just goes into hospice. They go into long-term care facilities, both independent and dependent, and go in and actually just teach the staff how to treat folks that are LGBT with respect. A lot of times you see a lot of seniors that are kind of battered, or there's violence that goes on because there's wrong people in those positions. But a lot of times where people just don't know certain things, so we go in and we actually teach those things, kind of a cultural competency thing. So it really teaches that sensitivity piece on how to treat other people regardless of who they are. All right, our trans services division. This division is very near and dear to us. We have a quite a sizable trans community within the Tampa Bay area. And as you know, that community has always been under attack, and we're trying to alleviate that. So we have that division who actually takes people. It's kind of like a case management department for the trans community. So we do assessments, we assign them to counseling, we give them peer support and group counseling. We have all types of peer support groups. We have Beautiful Transformations, which teaches someone who is trans feminine or is transitioning from male to female, how to do makeup, how to do hair, how to dress, and kind of give them those skills to kind of live their best and positive life. Because if you feel good, you have less health issues. So we try to address those needs to be able to address the bigger needs in the end. All right, fundraising and development. We are a nonprofit. So if you are interested in donating to Metro and the cause, or raising the roof for inclusivity is what we call it, with our new building in Tampa, you can feel free to visit our website, www.metrotampabay.org, under the Give section. There's testimonials there. You can read all about us, find out about us, and you can also reach out to our Director of Development, James Keene, who can also give you a tour of the new facility or the existing facility, and provide you with information materials and all of that good stuff. So we always say, you know, give to what makes you feel good and give with your heart. Volunteering, I actually am the coordinator for volunteer programs. So I actually hire all of the facilitators for the groups, the people that do different volunteering activities around the building, go to outreaches with us, table with us, help us with our community garden where we grow different flowers, and sometimes we do herbs and stuff to give to the community. We used to do like lemon or fruit infused and mint infused water that we grew in our garden. And so it was a good way to the community kind of be involved and kind of give to those that actually receive services at Metro. So again, an overall wraparound community center. All right, and this is just in. So the past few weeks, we have been approved to administer the COVID-19 vaccine. We are administering the Pfizer vaccine for those state-approved eligible persons. So 60 and above, K through 12 teachers, 50 and up, firefighters and first responders, 50 and up. Those that are vulnerable persons that are deemed by a doctor as a vulnerable person can get vaccinated as well. The only category we're not dealing with is the healthcare professionals that deal directly with patients, because that can be so confusing. I work in a health center, but I don't have, and I think I have direct contact with patients, but because I don't directly handle them, then I'm not considered eligible to receive it. So we've chosen not to service that category because it is that confusing. So, but as the state starts to open up and start to allow the additional categories to be serviced, we will open that up. We're currently scheduling all the way through the end of April. If you know somebody that fits any of the categories, please visit our website. There's a COVID vaccine in purple, like bright fuchsia link on our website. Send them there. There are space available for appointments to be able to get your COVID vaccine. All right, and then our motto is all are welcome, including you. 100 programs and services of health and well-being of our LGBTQ plus community and beyond. And that's it.
Okay, thank you so much for all of that wonderful information. So I encourage anybody who has any questions to please drop them into the questions section. I know Nate here will be very happy to answer them. And while we are waiting for the questions to roll in, I just want to let everybody know that I did drop the link to the website for Metro Inclusive Health in the chat section. So if you head to the chat section, you can just click on the link. It's right there. I have dropped the link to the website there. If you have any questions, put them into the questions section of the control panel. All of that was very, very informative. I knew that this was a resource, but I had no idea how expansive it was. I had no idea all of the stuff that you had. So we do have a few questions here. The first one being, you did mention that you don't have to be part of the LGBT plus community to attend like the workshops. Do you have to be a part of that community to use any of the health services?
No, it is all are when we say all are welcome, we truly mean all are welcome. The only people that we don't service are children that would see like a pediatrician. We don't have pediatrics with our healthcare, but anybody that is of age and up, they are able to come to get healthcare. If you're a youth and you want to join youth programming, you can join youth programming. We will do counseling for youth as well. We just won't do the primary care piece for a child that would need to see a pediatrician.
Okay, and speaking of children, do children need to get parent permission to use your services?
The answer to that is it depends. When it comes to HIV testing, you do not have to be, you do not need parental consent to get tested. You do need parental consent if you're going to use our counseling services. So that is an option. They don't have to know what you discuss with your counselor, but if you want to have a counseling appointment, because again, it goes through insurance, and we do self-pay on a sliding scale as well. Also have some programs that will offer it for free, but again, those require consents from parents as well.
Okay, and you did mention payment. So you guys, does your clinic take insurance? Do you take people who aren't insured? Are you able to use the services if you're not insured?
We do. So we accept all major insurances, including Medicaid and Medicare. We don't turn anyone away. We try to find a way for them to pay. We offer a sliding scale fee, which is based on income of the household. So sometimes people will come in and leave with no bill at all, depending on their economic circumstance. For our PrEP program, which is pre-exposure prophylaxis, which is a pill that actually prevents HIV, a lot of times people will walk out of the clinic and not have to pay for that prescription. So they are assisting in keeping the HIV epidemic rates down by taking that medication and practicing safer sex by doing it that way. So a lot of times there's programs that will take care of those costs and things of that nature. So a lot of times there's just a cost for the medical visit and the blood work. But sometimes those are things as well that actually get taken care of. But again, it depends on the financial circumstances.
Okay, perfect. Thank you so much. So it looks like that is it for our questions. I'm going to give another minute here for some to roll in. But while we're doing that, I'm going to go ahead and do the wrap up. So of course, again, thank you, Nate, so much for sharing all of this wonderful information with us. This is really good information, and I'm sure it'll help some people out. So
no problem.
Thanks. So with the library stuff, if you would like to contact the library, our phone number is there. Also, our contact link is there. If you would like to call us, call, text, email, chat, however you want to get in contact with us, it is there. If you would like to look at our other programs and events, we've also included the link to our events calendar. So we have a lot of good stuff happening right now. We are also in the middle of Women's History Month. So if you would like to see what we have to offer there, that is there as well. And again, if you would like to learn more about what Metro Tampa Bay has to offer, their website, again, I put that link in the chat section, so definitely make sure to check them out. I am going to do one more sweep for questions. It looks like we are good. So thank you so much, everybody, for joining us this evening. Thank you again, Nate, for sharing all of the wonderful resources that Metro Inclusive Health has to offer. Thank you again.
Oh, thank you.
All right, everybody, have a good night. Bye now.